that does not consider identity or biological sex as variable. This approach might sound natural or inclusive at the first glance, but neutrality does not mean fairness, and ignorance does not mean equality. We live in a world where gender and sex biologically different, and then it also affects health outcomes because men and female are totally different. Ignoring that doesn't make the research inclusive, it makes it blind. On the government bench, we are here to show you that this so-called neutrality has done more harm than good by overlooking a critical difference. As the proportion, we carry two responsibilities here. First, we will show you that we will show you that important gender-specific medical needs are being ignored or misdiagnosed because of this research. Two, we will prove that the harms caused by the ignorance outweigh any benefits of generalizing medical findings to the whole population. Let's move on to the background and our stance at the government bench. Historically, most clinical trials and pharmacist research have focused on male bodies because they were seen as the default. Women, especially those that are in reproductive age, were often excluded due to biological complexity. Then what is about the non-binary and transgender individuals nearly invisible in the data? The rise of non-gendered research in modern contexts was partly a reaction to gender bias. The idea was to treat everyone equally, but treating everyone the same in medicine is a dangerous simplification. That is where the harm lies. When you ignore gender, you don't get natural results. You get distorted ones. So let's talk about who is the vulnerable actors here and what is the right and obligation. First, women. Why? Because women are more likely to be misdiagnosed for a condition such like heart attacks or lack of hormone because their symptoms don't match male-based research data. Two, trans and non-binary people. Why? Because they also possibly had a medical needs, especially hormone-related and anatomical, yet not reflected in any of the data. Okay. Also, we bring the purpose of us being the government. Our goal is not to demonize the researchers or to say that every piece of non-gendered research is evil, but we are saying that a system that ignores gender in the name of simplicity is not doing science, it's doing harm. Healthcare research should be about accuracy, effectiveness, and saving life. But when you ignore gender, you risk giving someone the wrong drug dosage, and that could lead to a deadly movement. And then let's see the reality that we're facing today. First, women are more likely to suffer adverse drug reactions because most medications are tested on men. Two, heart attacks in women are often missed in emergency rooms because they don't follow the male symptom pattern. Also, we bring an alternative approach here. So in our world, research will be free and not going to be mixed. How is that? By this free, we mean free from the pressure to merge every group into a single blended pool just to make the result look broad. In our world, we separate the studies where it makes sense. We can dedicate trials for women, and we can also gonna run a dedicated trials for trans people or non-binary people. We run trials focused on how disease show up differently in different bodies. We will separate the research intentionally. Our approach doesn't just benefit marginalized genders, marginalized genders. Everyone wins in our approach when the research is accurate. Thank you very much.
For that speech, now I invite the leader of the
Here,
opposition.
yeah.
Sorry, golf team, I think they're still unmuted.
Oh yeah, sorry.
Okay, thank you. So I invite leader of the opposition. You're here.
Am I audible?
You're all good.
Okay. I'm currently have a power outage, so if I'm disconnected, please remind me through my teammate. POI through Harry's hand, don't unmute yourself. Starting my speech in 3, 2, 1. Several more interpretation to clarify. Non-gender research exists because diseases or drugs don't necessarily have connection with gender, albeit it's to some extent would have connection with hormones, but both female and male have estrogen and testosterone, so probably it would not be, probably it's not necessarily based on gender. That is why non-gender research exists. Most diseases usually a spectrum of connection on environment, gender, and DNA build, personal trigger events, and etc. That is why some men are able to get breast cancer, or passive smoker could get lung cancer, for example, although lung cancer are usually found in men. We think this reality check already negate the initial premise from Prime Minister that this is only shows based on gender because they want to do gender research, for example. Because they don't want to do a non-gender research, for example. Even if the majority statistics are true, like what they say, it will probably be a pseudo result under the side of the house because their research initially only focus on one gender. Because you notice that their burden is to prove why non-gender research is bad. Non-gender research is bad. Eventually, defending the gender research. Even if it's true what they say, the fact that anomaly in science exists should not be a justification for government team to discriminate research to discriminate research and also entirely negate non-gender research. We don't think non-gender research necessarily create misdiagnosis or treatment that won't be applicable for people like transgender, like what PM said. The idea of non-gender research is the fact that you would go through a process of research without having gender bias in mind, meaning you would take into account all kind of bodies, for example, all kind of situations. You am I audible? I don't think because
If you're good.
government said is it an alarm? There's no, I don't think so.
Wait, I'm sorry. There's like this weird sound. I don't know where it's from. It's not from my laptop.
Okay, sorry. I just paused the time. From my end, Sierra is talking all good. Maybe Gov can refresh their devices.
Okay,
I'm
I'll wait.
gonna restart my laptop. Is it okay if you wait for a bit? I'm
Yeah,
really
we'll wait.
sorry, Sienna. I'm
We'll
really
wait for
sorry
1
to-
minute.
Okay, thank you.
Okay. So under our side of the house, we do research without having gender bias in mind, meaning you would take into account all kind of bodies, all kind of situations. You would look into triggers and environmental causes as opposed to basing it on gender, like what they want under the side of the house, right? Which they don't provide positive case on that. So what the opposition team needs, the government team needs to defend is the fact that where research output is not holistic, why is it worth defending on the other side of the house? Because what we want under op is for science to be objective and as quantitative as possible when it comes to generating output. We want to have research with the most utility to the people because we want to protect people. We want to protect the most people, right? First argument: non-gender research is good and how it caters to the vulnerable actors. The benefit of non-gender research is the fact that first, it disregards gender biases. So the kind of disease or phenomena that we would research are not necessarily about estrogen or testosterone, but more on how certain disease exist in status quo and how would science fix the disease phenomenon in general. That is why, under our side, scientists research on AIDS because the phenomenon affects people the most, because phenomenon affects people beyond gender, beyond backgrounds. We research on heart diseases because it is number one killer in the world, regardless of the gender. So the variable of research under our side is far richer and far diversified because the intention is to create a drug or a treatment solution applicable generally for the people with the most with the utmost utility. However, in comparison on the other side of the house, which they need to defend and they haven't defended, when you aim to research based on when you aim to disregard non-gender research, you want to research based on gender. What you most likely do under that is that you would have a gender biased perspective. What you do is not finding what is the current rising phenomenon in the status quo, but what you do is what would be the number one killer for men or number one killer for rich men, because this is the majority of people that would access the side of the house. That is because in deciding the subject of the research, you would want to focus more on the majority background instead of the majority impact, for example. That is why Alzheimer research majority focus on male. Cancer focuses on lung cancer innovation as opposed to innovation on cervix cancer under the side of the house in the status quo. Moreover, poor people, this is like kusta or scurvy or hydrocephalus are not extensively researched in the status quo and under the side of the house because of these like biases that they have when they decide what kind of research they want to do under the side of the house. By virtue of utility, I think they under the side of the house we will impact more people, but under their side they will impact lesser people. Not only you will choose the social biases for researching on, for example, the majority gender or majority background, but you would also include more seclusions like classes seclusion and so on and so forth. Because notice that this kind of like seclusion in research does not have border under the side of the house, right? This is an alienation of anomaly in science because your research would be very, very, entangled to a conventional phenomenon as opposed to, majority phenomenon. So argument two, I think we think that non-gendered research would accommodate what the gender research want, and this is an exclusive benefit under opposition. What we want is the focus on non-gendered research would eventually lead to the benefit of to the benefit that the government wants, which is a holistic insight as an output. Firstly, since our variable of research is beyond gender, when researching on breast cancer, for example, our research would eventually find out that breast cancer affect women and men differently, for example. So the research would provide more holistic view on a disease that affect both gender, exactly because we don't have biases when we first start researching. Secondly, moreover, because we know that this general disease provide different effects to different subject variable, we know that the treatment needs to be generic because everyone can get this disease. So the research would probably focusing on finding how to create a treatment or drugs that would be applicable to both genders, as opposed to only catering to one populations or one kind of genders and so on and so forth, right? The difference lies in the mechanism of picking subjects of research. Under our side, we choose generally and have a spectrum of output, both general and tailored to the gender, because eventually it's part of our finding anyway. But under their side, since the choosing of subject is already within a biases perspective, their research output would eventually be very narrow and only applicable to the initial subject they start on researching. We think this is a very lose-lose situation under the side of the house, because in the context where scientific research are very expensive, for example, and take a very long time, which is a fiat in both sides of the house, their benefit would not be as utilized as our benefit, exactly because not only the output is not holistic, the output would be only applicable for certain backgrounds. Moreover, since the cost of research, let's say, are parallel on both sides of the house, it's the same degree of expensiveness, it's the same degree of taking a long time. Their target market is only certain gender, for example. They don't want to co-op people regardless of gender. Their market segmentation that leans on fewer people would eventually create a lesser profit potential that would eventually lead to big pharma constructing higher prices in the output of gender research under the side of the house. That is why if we talk about non-gender research, we talk about generic drugs or generic treatments that is far cheaper in comparison to tailored or personalized treatment that exists under the side of the house. This is a different, right? Not only under our side we try to cater on to a variety and diversified subject of research. The output of our research will be more accessible to people and will be applicable to more people as opposed to their side of the house. And we think that this is the only purpose of science that is to be defended in this debate. Very proud to oppose.
Thank you for that speech. Now I invite the Deputy Prime Minister. You're here.
Hello, am I audible?
Yep, you're good.
Okay. Okay. Let me set my timer and like check if everything's on start. Okay, wait, yeah. My name is Wendelin. My pronouns are she, her. And I will be speaking as the second speaker. Wait, let me, okay, wait, yeah. I will be starting my speech in, I will be starting my speech in 3, 2, 1. Okay. So in the end of the day, we feel like general diseases, like your example, AIDS and heart disease, will still behave differently across genders. So your argument of basically we will only take like non-gender related diseases is very much unvalid because hormones like estrogen and testosterone will still affect immune response metabolism very differently because in my classes, all I know is HIV progresses more slowly in women early on because women have like the viral load of estrogen and like the TDAP syndrome based on viral load standards compared to male patients. And things like heart disease, women often have like present symptoms differently than men. So like everything is about hormones, everything is about gender. We feel like this is very important because these aren't needs that are just like women issues. These are all things that causes that globally, right? We feel like a medical system that pretend diseases act identically across all gender actually will end up killing people through misdiagnosis or like things like late treatment because they do not accept that everything will affect people differently, right? Because in the end of the day, we feel like this isn't about inclusion. This isn't about how every treatment is different. This is not about how big pharma will profit over about tailoring medicine for women. This is about the patients. So I feel like this is very exclusive to the government side because oppositions say that general diseases and are not gendered by nature, right? But this is very wrong. Even if this isn't inherently about gender, we feel like the body it lives in will affect everything from diagnosis and treatment. That's why we want to focus on gender segregated care, right? Okay, continuing. We feel like medicine will affect all of lives, and we very much believe that gendered bodies will differ biologically, right? And in the end of the day, there's a lot of marginalized group that have became invisible in neutral research, right? Like as you want. So, because non-gendered often in the current medical world, there has been RCTs, random control trials, and control trials, CTs, that are mostly non-gendered and male by default, right? Even if they don't write the gender, a lot of the time is very much male. Why? And in the end of the day, women are misdiagnosed. One of my patients almost died because the doctors couldn't see if they have a heart attack or not because the books have written the symptoms that are commonly seen in male, right? Drug doses are all calibrated for metabolism. Male and woman drugs are very much different. It's like 4 grams for male is equals to like 3 grams for woman, right? Because and in the end of the day, there has been a very reduced cost, a very reduced journals for trans and non-binary people because they are mostly not researched at all, right? And in the end of the day, this causes harm in hormone therapy, in surgery prep, in things like mental health care, and even things like dosage for surgery, right? So in the status quo, we feel like non-gender research dominates. Why it dominates? Because in these RCTs and CTs, they do not write whether or not their patients are male or woman. So this is very much basically underrepresenting or ignoring gender differences between both of them. And this is not neutrality. This is not helping anyone. It's more of a systemic bias towards people who are male, people who have dicks, right? We feel like there's gonna be a lot of causal link of harm because these misdiagnoses will end up having delayed treatment, will have up increased morbidity and mortality, and increase rigor mortis like before the time is up. This will end up with poor drug dosing, with side effects, with overdosing or ineffectiveness. Because like you can even see like in cancers, like some drugs can be used on men yet not be used on women because they are heterogenic that and they can destroy women's health only, right? We feel like there's gonna be a lot of structural impact and how the system still currently continuing to fund and replicate male default research or that are hidden as like gender neutral because like they don't care, right? Because in the current medical curricula, everything training are based on this data that only writes male symptoms will be solved, right? We feel like this is very highly likely that this harm will occur because main default research has been the norm like right now, and it's still the norm we are learning right now, right? And multiple studies, like a lot of them, like RCTs and CTs, a lot of them have like ignored like a lot of the disparity and care quality and outcome. That's why we don't want every one of them to be turned into one, right? So we feel like the best case scenario on the opposition side is like they might say like some gender research exists now, right? But I feel like even in their best case, it's not going to be widespread or institutionalized because it's like very much reactive and it's not proactive at all because you guys are not thinking of the patient as the number one person. They are not your priority, we feel like. I feel like our worst case scenario is A, patients will end up dying or suffering needlessly because you refuse to give them actual research that actually cater to every of their needs. And in the end, they will like inequalities will get worse because like trans and female patients will end up instead of trusting the doctors, they will end up like losing trust and avoiding care entirely. Like and in the end, like even it will be harder to review, to reverse like things the longer it's if it's left unchecked, right? So going into my layers, we feel like even if gender research is slowly growing, it's not fast or systemic enough to fix like all the harm that has been done, right? And even if you say that male data like help this, help that, it's actually gonna be hurting others. And we feel like very much all of this ethical medicine must do no harm. Like if you're doing it like based on no gender, it will gonna harm someone, like for good or for bad, right? We feel like even if collecting gender data is difficult, we feel like the cost of inaction is higher because you will be actively killing people and will actively deepen inequality in medicine itself, right? That's why we are proud to propose. Thank you.
Thank you for that speech. Now I invite the deputy leader of the opposition leader here.
Am I audible? And
Yep, all good.
visible? Alright, set up my timer. If a POI can just unmute yourself. Pronounce she/her. Alright. Trigger warning maybe, if the content is going to be sensitive. Alright. Going to start my speech in 3, 2, 1. I think they never really define what is the difference between gendered and non-gendered research, but just to make it very simple, in non-gendered in non-gendered research, we have a more variety of the subject pool, and the researchers doesn't really care on whether or not someone is male or female, but they will probably try to have a more variety of the subject inside of the research in itself, right? Adding to the PM setup. But second, then what happening inside of government and gendered research, probably it means that you have a very limited subject pool, only in a certain attributes of people, only within the same attributes. For example, women, those that say those that is woman, for example, only have XY chromosome and so on and so forth, right? But a few point of but just to point out, firstly, the case of government is quite confusing. I think I don't really understand who they want to protect or who they want to save, right? Because they want gender segregations in like medical care or in like healthcare system, but how then they're able to have these segregations or be more effective, for example, if they also want to protect someone outside of the gender expectations? It's not just like talking about trans people, but they also mentioned something about non-binaries, right? So how then, with gender segregation in healthcare, they're able to protect all of these people that is different with the gender expectations, different with the biological, physical expectation in like male or female, right? But lastly, I think that mailish research at the end of the day also exists in government. Especially it's more prominent inside of government because you want to try to do gender research, right? And obviously, male will still be a part of that gender research. I don't understand why then in our side of the house we aren't able to cater to every single person because we do non-gendered. In their side, it's going to be way worse because since you have male gendered specific research, obviously all of those money, all of those harm that they try to they try to push into us probably going to exist inside of government, right? Before going to my extensions, 2 points of responses. Firstly, on the misdiagnosis, right? They try to push the harm into opposition, while misdiagnosis only happens inside of our house. Two responses. First, I think the prerequisite of misdiagnosis is if there is zero research for the specific people inside of side opposition, right? But notice then the context. Again, I already mentioned it's about the difference of the subject pool. In our side, we have more variety of subject pool. So basically, it's untrue that we have zero research of certain people because we try to cater to every single individual that exists on this planet Earth, whether or not they're male, female, non-binary, trans, and intersex, and etc. Right? But what's more likely happening but this is more likely happening inside of government, right? Because the thing is, when you have less variety of people, for example, or the subject pool is only going to be male or female, or probably if you want to try like trans femme and trans male and etc., it means that you have a further it means you have a further chance of misdiagnosis because all of your money is going to pull into this one specific research on this of this subject pool, right? But second, then I think even without even if there is a prerequisite analysis, I think it's still going to be untrue and misdiagnosis. Again, we have general applicant on the treatments, on the output, drugs or etc. Right? But even if we have misdiagnosis, I think it's still symmetrical in their side of the house. I don't understand why suddenly there is no misdiagnosis for women, there is no misdiagnosis of men, because there is still margin of error, right? But it's going to be way worse inside of government. Again, when you have gendered research, all of those money, all of those big pharma is probably going to focus again on male, something that the majority of people will see as more important, for example. So before they say that, oh, we want more research for women, we want more research for trans folks, they need to explain first why that's going to happen. But also, just very quickly, notice there will going to be peer review before the research going to be published, before the treatment going to be administered, before the drugs going to be, mass distributed to the people, right? It means if there is something wrong with the certain research for the general public, everyone will able to check and balance it. Scientists will just call the pharmacy out and say, oh, this is bad for like these certain people. For example, all of their harms non-existent. But second, then I think when they say they want to protect the vulnerable actor, I think this is very much untrue because the protection can only happen if the research is going to be effective, right? The Maut already explained that there is going to be gender bias inside of government because gendered research basically happen because of gender bias, or the conclusion of that certain treatment is going to be gender bias, right? So how then protection can actually happen inside of government? They never explain it. Probably if it's true, it's going to be the easiest way out. Just chuck it up as anemia. It's all because of female. It's the biology of female, not because of environment and etc. Right? But I think we're able to flip this idea better about protection later on my extensions. But lastly, they push the idea of personalizations because these drugs harms women, these drugs harms male. Notice that this happens because of the gender research that only existed inside of government, right? I.e., why certain drugs only effective for certain gender? Exactly because big pharma only focusing the research of these certain drugs to certain gender. Big pharma are able to exploit the male and female or the difference of genders, for example, because they're able to create market segmentation, because they're able to create a more expensive drug for women, for example. Going to my extension then. First, whether non-gendered research will create a more effective output. We bite the bullet, sure, there is certain diseases that have different effect and effectivity for like different genders. But exactly, this is why we need gendered research, right? The effective treatment, how it's going to happen on three things. Firstly, non-gendered research will, research for the greater of all, right? Then it means that we have a variety of attributes in the subject pool. It means that it's not going to exist in a vacuum of a certain gender only. It means that we want to create a drugs or a treatment that is able to cater to every single individuals in our subject pool. Inside of government, you have a limitation of variety. More importantly, all of those drugs, all of the treatment is probably going to be effective for the people that have the same variety, the same attributes in your subject pool, like male or female, etc. Right? But then, in the future of science, we want to create the general good. This means that's not just generic drugs, but to an extent, treatment for a certain diseases, for example. But lastly, generic drugs is generic and cheap because everyone are able to use it. Everyone are able to be, utilize that idea, right? In the end, we are able to find the most effective treatment, the most effective drugs, because we want to we want to cater to every single individual that exists within the spectrum, right? But very quickly, second extension is why non-gendered research able to cater to a broader spectrum of people. Notice that the spectrum of people inside of gender is many things, right? Outside of the binary or non-binary, for example, trans people, those who already are going gender affirming treatment, meaning they have changes in hormone. Or maybe someone who's intersex, for example, male with uterus will also have changes in hormone. It's also different than just a cis male, right? So it means that in our side of the house, we're able to cater to this massive spectrum of people. Exactly, because we're not alienating these people. Because we're not saying, oh, this drugs is only for women with this certain like grams, for example, or this drugs will be harmful for male. Because it's more than just male and female in the current status quo. But lastly, why then it's going to be way better is because we're going to be more effective for everyone, at least in our side of the house. Even if it's not going to be that effective, we'll have less of side effects if it's going to be used by everyone, right? So it means that the protection can only be existed inside of opposition proud to oppose. Thank you.
Thank you for that speech. Now I invite the government whip. Here.
Am I audible enough?
Yeah, but can you increase your volume? It's a bit muffled in my end.
Okay, how about this one?
Yep, much better.
Okay. Before I start my speech, I would like to remind that all my speeches was only for debating purpose only, and I'm sorry if it might sound short at some point, but trust me, I didn't intend to. Yeah, I will start my speech in. I will start my speech in 3, 2, 1. Good evening, everyone. Hereby I stand as the third speaker of the government team. As we come to this part, I believe we all have agreed and aware that this debate is focused on why non-gendered research considered to bring more harm than good at this state on the motion. And I will try to crystallize the ideas that has been given by my previous speakers to prove that it's better to let the government win the case. Judges and my fellow debaters, we have to be aware that the main stakeholder that got to be affected the most by this motion is the patient, the human itself. We can't deny that the purpose of why human keeps trying on improving and upgrading their knowledge and skills on science is for the sake of our own lives. Hence, okay. Can I wait for the other judge?
Okay, hold on. I guess we can wait for Adelia to close her window. Since it's yeah, since it's below 1 minute, so you can restart your speech. We'll just wait until Adelia is done.
Okay.
All right, so Govwhip, you can restart your speech.
Okay. In 3, 2, 1. Okay, so good afternoon, everyone. Again, hereby I stand as the third speaker of the government team. As we come to this part, I believe we all have agreed and aware that this debate is focused on why we believe non-gendered research considered to bring more harm than good as its state on the motion. And I will try to crystallize the ideas that has been given by my previous speakers to prove that it's better to let the government team win the case. Judges and my fellow debaters, we have to be aware that the main stakeholder that got to be affected the most by this motion is the patient, the human itself. We can't deny that the purpose of why human keeps trying on improving and upgrading their knowledge and skills on science is for the sake of our own lives. Hence, by letting the opposition teams win, we only going to harm the humanity. Why? It actually has been proven by my previous speakers. First speaker of the opposition stated that it's quote unquote, it's disregard the hormones differentiation and focus on more to creating a solution rather than focus on the background, which has been proven wrong because depending on the points that my second speaker has stated, such as the major one are humans have different hormones, different drug reactions, and there are different diseases.
This is why having the non-gendered research that actually erased the main points that needed to be considered and would be a different results from what it actually supposed to. And this will be a different case if we are talking about the intersex and transsexual people, as they have another different hormones that need to be treated in a whole different way too. Hence, this has proved that gender-focused research is necessary and needed rather than non-gendered one. Saying that treatment should be given equally in general because everyone can get the disease is like saying that giving each people 1 million to end the poverty, in which we are generalizing solution for our complicated problems, won't be a solution itself. Especially when it comes to scientific problems and healthcare, medicine is a complex thing that cannot be applied to the same to everyone. No, thank you. Another example, one person can get different reaction compared to the other by giving them the same amount and type of drugs, even if they have the same gender. Because at the end of the day, they still have different backgrounds of health condition that has been explained by my second speaker that should be considered in order to make the drugs given to be effective, just like what the government and even the opposition wants to, and be a solution rather than just giving the same treatment and hoping everyone will get the same reaction that is healed. To answer the second speaker question on how government would able to protect the other genders, we have to be agreed in one thing, that science can't be driven by what the society wants and vice versa. It has different purpose, both to keep the humanity alive. However, to sacrifice the science by driving it based on what the society wants will cause harm that is bigger than what we could expect. Gender identity and sex assigned at birth is a whole different thing that cannot be mixed. This is what we're supposed to keep in mind to make sure that the debate doesn't go anywhere other than this. The opposition has been focused on being fair and giving justice for the society rather than actually facing the main problem. Again, this is not about the social injustice of the segregation genders and making them get different treatment in order to be fair or not, but the main purpose is to make sure everyone gets treated the best based on their condition, in which difference for each. Opposition wants to make the research be effective and make sure everyone gets the benefits. But it's actually going to be more complicated as we are talking that scientifically, you cannot mix a random data in order to make a good result. Again, this is why we believe on gender-focused research is needed and still be a better option than non-gendered one. About the big pharma that they were talking about, it is making research to be only focused on the male or female one. That's the thing that we all should be focused about to engage the gender is not only driven by sex assigned birth, yet this is why we come to the mechanism that is bring by our side of team. So what we bring to the table as a government, we'd offer that first. Researchers will be free to research things on their own targets, which is good because the diverse of research would eventually help science to be improved and adding more knowledge in terms of finding solution and prevents the disease, which leads to a single purpose of it all, to help the humanity and making our life as a human longer. So in our word, it will still be a win-win solution for everyone since we won't do anything to those research that has been done tested like AIDS, certain generic drugs, and etc. that has been stated in the side context of the motion. Instead, we're going to focus on engaging more gender-focused research with the base arguments we had to make a better situation. By all means, we as the government has never in slightest to be against the gender minorities community and invalidating their existence by standing in the male or female only as gender in the bigger picture that we are focusing about. But this has proven that to be what it needs in terms of medical condition. Dividing the research to be focused on each gender was purposely to make sure that the research would get the best result as each gender has different reaction and needed. Though in fact, biologically, the human body can only be discovered by two, male and female in a bigger picture, in which we are talking about the sex assigned at birth. But this doesn't mean that the government side will forget the intersex and transsexual. In this case, those who got hormone injection, it actually intends to make a better solution for them also, as they would get their gender-focused research as well, depending on their condition, just like what we offer as the mechanism. No, thank you. As we all agree that gender and sex is not the same thing and gender is free. At the end of the day, the purpose of gender research is to help humans and to get a better condition and find a solution to their health problems. This is what we should be focused on rather than anything else. Thus, we believe this. It is best to win the government in this case. Thank you.
That speech. Now I invite the opposition representative.
Okay, checking if I'm audible.
Yep, all good.
Okay. Pronouns are he, they. Please, if you want to POI, please unmute because I won't be looking at the chat box. Okay, start off. Yeah, I'm going to talk about gender a lot. So, quick disclaimer. Yeah, starting my speech in 3, 2, 1. I think one simple framing to tackle down the government is that their explanation is heavily reliant on every person in the same gender having the same or very similar attributes towards one another. When we have already told you since the very beginning that gender is unique, that different people have different hormone levels, that there are women who have higher testosterone levels than other, that there are trans women who, after hormone therapy, have estrogen levels that are even higher than cis women, that there are women who have genetic differences that have chromosomes other than XS, which probably affects their hormone levels as well. And we think that they deserve to be protected just as much. What gender research does is that it alienates these biologically unique women and also even biologically unique men. And that is why we think that non-gendered research should be upheld and should be better for the current status quo. So firstly, I'm going to explain, since they want to talk about women and gender minority so bad, I'm going to engage and tell you why it will be worse for women and gender minority. Because under our side, we want to argue on the effectivity. Because the only way that we can actually create protection and a treatment that caters to these women and gender minority is that we can prove the effectivity of research to be able to provide the correct treatments for these vulnerable actors. Because we think that effectivity is harmed under their side because of several reasons. Firstly, we think that the prerequisite of effectivity is that you can make a conclusion that is objective, unbiased, and considerate of all scenarios and different types of women. Why is this harm? Because when you are making research gendered, it means that you are limiting your samples, the attributes of your subjects. Therefore, the results of your research is not going to be applicable to a large spectrum of people. They cannot say that that's good because research for women is not going to be catering to men anyways, because I'm not talking about men under our side. Because I already told you that women exist in the spectrum, even if it's rare. Oftentimes, there are women who have different hormone levels, that there are intersex women, that there are trans women. And the problem is, when you make gendered research, the people who are going to be the subject of these women gendered research are going to be most likely more conventional women who have a generally normal hormone levels, cis women, because these women are the one that make up the majority. So probably these are the women that are enriched with these scientists, and most likely that even if there are going to be several minorities, it is going to be very small, and the majority of the women in the test samples are going to be very biologically conventional women. So when the research are catered only to them, the impact is several things. Is that this is when the more biologically unique women feel alienated because the treatment that was supposed to be for women doesn't even cater to them, because they don't cater to the different hormone levels that exist within women, because it's only going to cater to the more conventional women. But also B, this is when you will actually endanger their lives by making treatments inaccessible for them, because you don't want to take into consideration of the kind of uniqueness that they have. But even if they want to say that if that's the case, then probably it is more unique, the women with more unique hormone levels, that they can just be assigned treatment designed for men because they're the ones who take into consideration of a higher testosterone levels. I think it just alienates them even further. Just think about what will happen when you assign a trans woman a treatment designed for men. It's going to be very harmful. And no, they cannot just say that it's going to be good for gender minority, because there's also going to be research focused on gender minority. I think with how the status quo even perceives trans women and gender minority, there's still a long way to go for us to even have a research centralized on them. So most likely that the research is going to just be men and women, and you shouldn't buy this very unrealistic scenario and characterization. But why is this change when researchers are non-gendered? Because it takes into account of the applicability of a larger spectrum of people. You consider whether or not the drug is effective to people with different hormone levels, different testosterone and estrogen levels. This is how gender minority and biologically unique women can be protected, because research is non-gendered, which means that the diversity and hormone levels in the research exist, and that is how the methods of treatment can extend to them. But second on my substantive, I want to sort of mitigate on the misdiagnosis on women because research are centralized on male bodies, which is a big part of their contribution. I think first response is that this is a value judgment motion. If they cannot explain why this is a direct cause of gendered research, they lose. But second, I don't understand why they try to frame that the reason why in status quo women gets misdiagnosis and why treatments are male-centered is because researchers are non-gendered, because it's intuitive that if certain drugs and treatment only work for men, then it's probably because the research is gendered and only tested for men. So if the research is non-gendered, then the result is that the treatment is going to be applicable in a general way. But they say the only explanation they bring is that they probably big pharmas are probably going to hide this male-centered research under the guise that they are gender neutral. But this won't be likely. Why? Because scientists have integrity and researchers follow a long process. My DPM, they already explained that there's peer review. They need approval from many scientists. And even if that doesn't work, I think it's as simple as these scientists and big pharma don't want to lose their credibility in making like objective and good researchers. So I think that answers the burden, that it is unlikely that they will get a predominantly male sample and create a research that is very male biased, then try to frame it as gender neutral, because obviously the peer review want to prove it. But if they want to say that they will, because status quo is male-centric and they don't care about women, I think this is untrue, because society is already progressive, feminist movements are already getting big and getting radical, and there are already a large increase in women in STEM, especially in the medicinal field. That's why women in STEM currently is very, very glorified and like romanticized. So I think we have proven that male-centered treatment is not a product of non-gendered research, and we argue that this is actually a product of gender research. Most researchers being mostly about men. Likely why? Because man is viewed as more important. But second, on women's struggles being dismissed, things as simple as the impacts of menstruation, it's important, keeps being dismissed. That's why women don't get to take leave when they're having period cramps. But also because gender research doesn't take into account of certain issues, social issues that may contribute to why diseases exist. Because this is probably why gender research happens, is probably because they see that most people who do get this disease is of a certain gender. Like how lung cancers has more gender research on men, because the larger demography of smokers are men. But that doesn't mean that women are less likely to get lung cancer. This proves why gender research is bad, because they become less likely to find the actual underlying reasoning to why certain disease manifests, because scientists are more lenient on saying that gender attributes become the reason towards certain diseases. No, we're not saying that scientists will just immediately say in gender research happen because certain diseases happen because they're women, but we think that when they're stuck on certain conclusions, there's a higher chance in like letting their bias win and saying that certain things happen because of the gender when probably it is actually not. This is the kind of harm that exists in gendered research. Very proud as opposition. Thank you.
Thank you for that speech. Now I invite the opposition reply. You're here.
Am I audible?
Yep, all good.
Cool. All right, setting my timer. Start my speech. 3, 2, 1. As my whip mentioned, this is a value judgment debate, as government team doesn't have any exclusive benefit nor a studying harm. This is already a opposition winning debate, right? But second, then I think government is very dismissive to the case of coming from oppositions, that it makes all of their engagement or their responses very not charitable. Notice that we're able to frame in our set of propositions, the effectivity of non-gendered means that everyone are able to take it. It's already able to flip all of that idea of harms of what about women misdiagnosing and women misdiagnosing and like uninfallible actors, but how gender bias existed inside of government. Let's take a look at my PM speech. Take a look at my OO speech is very important, because notice that government side never respond or never engage to this idea that the gender bias existed only in their side of the house, exactly because of gender research, exactly because all of those research are only going to be portrayed to a single gender, for example, or even if it's not, as my whip already mentioned, they're talking to be the easy route of a certain conclusion. Gender bias is all of the parameters of harms coming from side of government that only existed in their own case, right? But this is a very important framing, because to weigh this debate, right, it's obviously going to be whether or not the non-gendered research causes harm or good, right? In our side, we obviously say that it doesn't cause any harm. It's cause only good thing, right? We give you the likelihood analysis as well as process analysis. We're also able to engage the case coming from government, even to an extent of being charitable to their case, even when they don't really have any process analysis. But what happened inside of government is that they doesn't engage to our case at all, right? They're very dismissive of the context that we're already able to give to you. But they're also not considering to the fact to the harm that only existed inside of government, i.e., they already they already failed with their logic of that certain drugs is only effective for certain gender, which is actually a problem, right? But the thing is, they fail to explain why then this is only happening inside of opposition, because the thing is, it only happened inside of government, where they're very easy to be exploited by certain pharmacists or certain researchers, for example, where a certain drugs can only be effective for a certain gender, exactly because of the gendered research that's happening inside of their house, right? In our side, we say that gendered research will be more effective because we want to cater to every single people in the spectrum, regardless of their hormones, regardless of their identity, for example. It means then that there's going to be more generic drugs are going to be existed. That's people going to be easier to consume, for example. But notice that they already failed because they try to cater to those people, because they already admit that people with the same gender have different level of hormones, have different level of like physical level to make sure whether to cater to a very specific of people with a very specific attributes, exactly because they have a very limited subject pool with only a very specific and a very limited variables, right, that only existed inside of government, right? In our house, we cater to every single person that existed, regardless of their regardless of their gender identity, regardless of their hormones, regardless of whether or not they're able to take a certain drugs, because we want in our side, we're already able to prove that research is going to be way more effective, exactly because we are doing it non-gendered, because we try to cater to every single varieties of people that existed. This is why all of those misdiagnosis probably going to be less likely happening in our side of the house, because all of our drugs, all of our research, not just going to be get peer review, but it's also going to be able to cater to much more broader spectrum of people. And but second way, then, if you want to talk about the scale of impact, obviously inside of opposition, we're able to argue that our scale of impact is going to be way larger, aside from the fact that it's going to be a larger spectrum of people, but also on the on how the efficient treatment that only going to exist in our side of the house is going to be even to a broader range of people, right? Not just based on gender, but probably those who are in poverty as well. In their side, it's going to be way much more exclusive, meaning that a very limited scale of impact proud to oppose.
Thank you for that speech. Now, before we close the debate, I invite the government reply. Here.
Okay, give me a sec. Okay. Timer. Starting my speech. I'm sorry. Starting my speech in 3, 2, 1. We feel like this is a debate about what kind of medical research can save more life and can reduce more harm in the long term, right? We feel like the opposition defends authority too much to the point where neutrality itself, we feel like actually erases the biological realities of gender, and that erasure will lead to mistreatment, misdiagnosis, and death, right? We already told you that even if the intention is like that, the outcome is going to be dangerous. Yes, women might have different levels of estrogen, but there's gonna be things like clinical trials and shit, right? We feel like we have a few points of reclarification first. We feel like we have to highlight how gender influences medical outcomes, right? Second, we feel like there's a lot of things such as non-gender research that can fail to capture and respond to variants, which leads to systemic and deadly biases. There are things such as RCT, as I have mentioned before, that takes a lot of women of different spectrum, right? We feel like opposition bench one a one-size-fits-all science, and we have proof that that approach kills people, especially women, trans, intersex, and hormonal minorities, right? So going into the first clash, we feel like there's gonna be a clash of accuracy versus objectivity, in which we feel like gender neutral research is more objective and scalable, right? So our response is, we feel like it's about testing across it, right? Because in their world, we feel like neutral really means male with its whole. We feel like proposition choose non-gender data and like some incomplete data, but uh Secondly, we feel like we can serve more people. We can actually leave out more space for intersex and trans people because in the status quo, non-gender research already leaves them all behind, right? We feel like our model here actually helps research by tracking things like hormonal variants and such, right? Continuing, we feel like we are the only place that can actually deal with real world consequences such as heart disease and such. We feel like even if the opposition world leads to slightly more funding, we feel like that funding supports research that doesn't work on everyone, right? So we feel like we win this debate. Thank you.
Thank you for that speech. Now that marks the end of the debate.